There's nobody. Okay. Hello, everyone.
I think we can go ahead and start, he said, yeah.
Yes. Hello, everyone. Welcome back to another live question answer session from Scholarship Track. This session is the USMLE IMG Pathway Series, and I'm Vidhi Parekh, content writer at Scholarship Track, and the host for today's session. We have with us Dr. Rutvi. Hi, Rutvi. Thank you for joining us tonight. And Dr. Rutvi is a PGY1 pediatric resident and Match 2020 applicant. And so before we start this session, I would like to tell you what this is about. So during the first half of the session, I'm going to ask few questions to Dr. Rutvi. And then she's going to answer all those questions. Meanwhile, all the audience, you can keep on writing your questions in the comment box, and which all those questions will be answered in the later half. That is after I'm done answering all the after Dr. Rutvi is done answering all those questions. So shall we begin, Dr. Rutvi?
Yeah, of course. Let's go.
Yeah.
So, a little bit about my background and my USMLE journey. So I grew up in the United States. I did all my schooling here, and then I decided to do med school in India. So knowing going to med school in India, I knew that I wanted to come back and I wanted to do USMLE. So like right from the beginning, kind of, tried to find out about a lot of things. The first year was just kind of adjusting to the Indian schooling system again, to learn how it works so I can actually pass my my MBBS without, any setbacks, and then kind of starting my USMLE journey. So the first few years, I kind of just find out about the resources to use, how to start studying for it. I got more into actually learning how to study for it towards my internship, and that's when I started preparing more. So a little bit about my journey. Again, started preparing for step 1 towards internship, end of internship, and then I took a year off before applying because I wanted to finish all my exams beforehand and get some experiences as well. So I started preparing around, January of 2018, took my exam for step 1, December 2018. Then I studied for my step 2. So I took that in May of 2019. Step 2 CS, the practical exam in June of 2019. And then I applied September 2019 to match into March 2020. So that's kind of the background and how I started working towards my USMLE journey.
Yes, very inspiring. So your next question is, can you tell me about the test taking strategies, especially during step 1, like how a USME aspirant should study, like, like you have this 40 minutes time slot. That will you throw some light on that?
Yes. Okay. So basically, step 1 is an exam of your basic sciences. It goes all the way into all your biochemistry, your pathophysiology, everything very deep. So the main goal, how I started studying for this, was the first 6 months, I kind of just went through first aid, using that as like my primary book, and then I supplemented that with many additional sources. So if I go like subject wise, for biochem, I mainly used Kaplan videos for that. Immunology, I used Kaplan videos for that, and first aid. And one thing I just want to put out before I go into more detail is that first aid, the step 1 book, they come out with a new book every year. So honestly, if you're not sure that you're taking your exam in that current year, I think it's very important to buy the current version of the book. So suppose you're unsure in like 2018 that you're going to take the exam or not, I wouldn't buy the book in 2018. I would wait till like January of 2019, then buy the book and then use it as a resource. just because they keep updating stuff. And if you have like a PDF version of the book, or like an older version through any of your resources, they have a website on first aid where it tells you what they've updated. So just keeping that in mind. And then also one thing that I did was I used my first aid as my main book, right? So I would put all my notes in there, everything else from additional resources in there. So at the end, I only had one book that I needed and I didn't have notes everywhere else. So I think that was kind of important. So again, then going back into like what resources I used, microbiology, there are these videos called Sketchy Micro, which I think was kind of the best thing for me because I'm a visual learner, and I remember things more with mnemonics. So that's what they kind of use. So using that was really helpful. Pathology, I use the Pathoma videos, and those are golden, of course. They do a really good job of explaining everything. Pharmacology, I used First Aid, the company that makes them. They have their own video series. So I kind of used that for pharmacology purposes and some YouTube videos as well. And then for public health sciences or like the biostats portion, I use YouTube videos. And then organ systems, you kind of just need to, anatomy-wise, I use, again, the first aid videos that they have. And then physiology, there is a community on YouTube called Ninja Nerds. They do a really good job of explaining all the physiology and information as stuff. So I kind of use that for physiology. Then what else? Sorry. Just specific topics. Like cardiac murmurs, endocrine physiology, autonomic drugs, and anatomy. So cardiac murmurs, there are really good YouTube videos on that kind of explain, the sounds and what you would find in each one. Endocrine physiology, I had a tough time with all the hormones. So Ninja Nerds, again, does a really good job of explaining that. And then autonomic drugs, there's also with Sketchy Micro, there's something known as Sketchy Farm. And
Sketchy Farm, yes.
Sorry?
Yes, heard about that. Yes.
Yeah. So they have Sketchy Farm. I was not able to use Sketchy Farm too much because then all the drugs got really confusing. So I only use Sketchy Farm for like the antimicrobials because it connects with Sketchy Micro really well. And then I used Sketchy Farm for only some of the drugs, such as the autonomics as well. And then anatomy, there are these anatomy shelf notes that you can find on some various Facebook pages. I do have a PDF that maybe I can share with VD, and then maybe she can share with you guys.
Sure, I'll forward it.
Okay, yeah, so there's just this anatomy shelf review. I think a med student from the Caribbeans made it, and it just kind of gives you an overview of everything that you need for the exam. So that's kind of that. But again, for step one, I think the first 6 months, doing like your whole review would be important. And then kind of when you're in your dedicated time, like maybe 4 or 3 months, that's when you would probably do more focus review, like from whatever notes you took. And I cannot stress this enough, but starting early for step one is important. If you want to start in your first year of med school and you're able to, do your MBBS stuff and your USMLE stuff at the same time, go for it. Starting UWorld early is also important. So when you're starting studying for it, I think doing questions, even if you're doing random questions, it's okay to do it randomly because UWorld, once you answer those questions, it gives you a summary of what you need to do. You can even approach those questions in a stepwise manner, like a system-wise manner. So I think doing questions is important. Again, I was always advised to do timed so that you understand how much time you'll have to answer questions. Some people do the tutor method as well, but just I think doing UWorld early. And another thing that I learned about a little bit later, which I wish I had known earlier, was the Anki flashcard. That is basically like a flashcard. Anki Web is an app for flashcards. It's for any subject ever. But there are very specific decks of people on a website called Reddit that you can download and put on there. There's more information on YouTube how to use this app, but doing that was really helpful as well. So I think starting early is one of the main things.
Yeah, and how about osmosis and emboss? Like I've been hearing a lot about this too, like how they are like.
So Amboss, I didn't really use it for step one at all. I just focused more towards UWorld, and I think I was mainly advised to use UWorld because it's very helpful and it talks about everything. And I think it's just more wholesome. So I think UWorld, I didn't really use Amboss, so I can't comment on it. Some people do and they like it. But I didn't really use it. And Osmosis, I think the only thing I've seen for that is like YouTube videos. And again, it just kind of gives you the overview of the disease. It doesn't really go into detail. So maybe for like a quick revision, I would use it. But if you're doing like more focused study early on, then I don't think I used it for
osmosis. That. Yeah, because I did the same and I felt the same. It's kind of superficial at times.
Yeah, it's a very basic overview of what the disease is and what the process is. So
yeah. So your next question is, what according to you is the ideal time to give step one? Like many of the IMG is pretty confused, like whether to give in, final year or internship after that. What do you think?
Honestly, I think this question is very person dependent. It's how you study, how you're able to handle everything at once. It's really up to you. For me, I was trying to study for it to take it in my second year because you do have a little bit more free time in second year. But obviously, I was not able to do that. I was not able to get all my studying done at that time. So I think that's very dependent on how you want to approach things. For me personally, it was easier to take it after internship and to take a year gap to take these exams and apply. Some people take it right at the end of their final year before their internship. Some people take it during their internship. I've had friends take it during their internship and they were able to do well on it. Some people take it as soon as, their second year gets done. It's very person dependent for this question. If you feel like, you kind of want to discuss that further with me, you're welcome to email me at any time. But again, it's very dependent on how you want to do it.
Person to person,
Yeah,
right?
it varies person to person, how you approach things, how you're at studying, how you feel comfortable.
Okay. Your next is, okay, what resources would you recommend for step one and step two? I think you already talked about step one.
Step one stuff. Again, just to revise, first aid, UWorld, YouTube videos, for sure. Like YouTube is very expansive. Please use it. If you don't understand something, take time to, find out about it. That's a free resource, so use it. Then Pathoma, Sketchy Micro, those are some things as well for step one. For step two, my main resource was actually just UWorld. And then there are these videos on a website called Online Med Ed. I only used the videos for it. I did not get the whole, I did not pay for like the whole questions and their, booklet or whatever. But I just used the videos. I made my own notes from that. And then I used UWorld. And again, using the Anki decks is really good as well. They kind of give you, like a constant repetition. So I think using that for step two was important. I was not able to find a good book for step two because a lot of people say first aid. Some people use like, what is it called? I'm sorry, I'm blanking. It's a book. I'm sorry, I'm blanking on it. I cannot remember the name. Yeah, but a lot of people use a lot of different books, but I was just not able to find one that would give me an overall kind of view. So I just kind of made my own notes from the videos, made notes from UWorld, and just went from there.
And this other video called other USMLE dirty videos. Heard about that?
Yes,
yeah, I found it pretty good.
Used that, and those are really good for mnemonics and kind of towards the end of your studying period when you just kind of want to remember things and memorize. I think they have really good mnemonics. So using that was really good too.
Thank you. And next is, apart from the USME scores, what other things help to make a holistic CV, like be it research, publication, or voluntary work? Like, can you throw some light on such aspects?
Yeah, of course. So I think aside from your store or your scores, it's very important that you're seen um, as a well-rounded student, I want to say, and also focused on the field that you want to apply in. So one of the things is definitely like volunteer work. I know in India we have so many like NGOs that you can be a part of, or you know, if you approach your college, you're able to create programs and kind of just doing that kind of a work, starting something at your college is important. Um, and then again, research. I was very lucky that my college and the professor that I worked with was very, you know, wanted to do research, was very encouraged about it. Sometimes you're not able to find that. So that's okay too. But if you do have the opportunity to do research, I would definitely try to do that. I know ICMR does,
Yes, I
you
see.
can
Every
apply for
year,
ICMR grants and do research through there.
yeah, I applied
Um,
for that. Yeah.
yeah, so definitely try to do that, or just approaching a professor that you know would be open to doing research. I think is important. So research can help for sure. Even if you don't get published, it's okay. Just being able to talk about your research experience in your CV is a good thing. And on ERAS, when you apply, you know, you have to create your own CV on there. Like you don't make your own and, you know, upload it. You have to write everything down on ERAS. And they do give you an opportunity to talk about your research experience. And you're able to put in there that, you know, I'm not published, but I'm still working on it. You know, it's pending work. So kind of trying to do that as well. And then trying to find some electives in the United States is also helpful to your CV to learn the American system. You can, you know, apply to a university. You can apply through a private. I applied to a university base and I was not able to get it, so I applied private and I was able to do it through there. And also, if you have family in the United States, if you have family friends in the United States, use them as your resources. Talk to them that you know you're looking to work in the United States, you're trying to find a doctor to work with, and you know maybe something will come up, and you know you might have a family friend that has a private clinic that you might be able to do an observership at, and I think that's important. And even if you don't have that, if you have family in the United States, try to find clinics around that area where you would be able to travel there and work. I would call offices, doctors, and talk to them like you're a student, you're looking for work. You know, what's the worst they can say? They'll say, no, we don't do that. So just reaching out to people is very, very important. Making yourself known that you're applying, you want something, just doing that, I think really helps as well.
And one more, like I have been hearing a lot about gap year. Like,
Mhm.
how does it make a difference in the CV? Like when you do upload it on ERAS, like for an IMG, like what are the views on gap year?
So, with your gap year, I think one of the main things to keep in mind is that you are taking a gap year to take your exam, but they're going to want to see that you're still active in your medical field. So, it's okay to do a gap year, I think, but making sure that you stay active in the field, you're constantly doing something is important. Just, you know, being at home is not okay. So,
Mhm.
suppose, you know, with the virus and everything, people are not able to travel to the United States to do electives. So maybe even working as a medical officer in one of the, you know, rural areas
Frontliner.
in India, I think that's a good way to show that you're active in your field, that while you're studying, you're still, you know, working as a doctor. So I think being able to do that is important. It's okay to take a gap year, but you need to explain why you took it and what you did during it. So make sure to keep that in mind for interview questions.
Cool. Next is a piece of advice to optimize, especially during preclinical and clinical years. Like, here during the first and second year, students say, they want to do USMLE, but they don't know where and what to start and how to make a holistic CV. So, what they should do during such years, like make most of their time,
Okay.
utilize like most of the time.
So something that I really wish I'd learned about in my first year was the Anki flashcards. Now, in your first year, I know anatomy definitely keeps us busy. So does
Yes.
biochem to some extent, and so does physiology. So I think starting out with flashcards is a really good thing that I've advised a lot of people earlier on. Like they asked me what's the one thing that we can do. I think doing flashcards would be really, really good. And you're able to, they're free. First of all, they're free. You can download them and you can do them every day.
Yeah.
Even if you do like 10 of them a day, it's really good. So I think during your pre-clinic or like first year, that would be the best thing. Now, during like, starting second year to third year to fourth or third, second, I think focusing a lot on learning about patient care is important. We sometimes, we have clinics in morning. We go to the hospital and do stuff. But I think we don't take that as seriously as we should. And I think focusing on that is really important,
Taking
especially,
history and all.
yeah, like, developing your history, developing your history, like how to take a history, how to do your physical exam, approaching a patient, like how to manage. I think that's important. And the best way I learn is that if I see something and if I do those things, I'm going to remember it for my exam. So maybe like when you see a patient, try to read about that patient, towards the end of the day and just learning about their disease process and how you did what you did. I think that will help you towards, at least step 2 for sure, to see how you're managing that patient and what you're learning from them. And then against like improving your CV wise, sometimes we have really, really interesting cases that come to our hospitals. They're very rare. So maybe talking to a professor about even doing case reports.
Exactly, yeah.
That would be really good too. Taking initiative is very important. Residents in some of these hospitals, they're very busy, they're overworked, and sometimes they're not going to teach you just like that. You need to approach them and be like, oh, can you help me with this? Or, why are we doing this? Or just asking them questions is very important. So I think taking an active part in your clinics in the morning, those 3 hours, at least we had 3 hours, is very
9 to 12,
important.
yes.
And sometimes if you have interesting cases, or, if you want to go after college and go talk to patients, go for it. Like no one is stopping you. You can actively do this, and it will definitely help your communication skills, your interpersonal skills with patients. And I think that goes a long way when you match here in residency. So I think working towards that is really important.
Cool. Next is insight into clinical electives, especially in the United States, and its importance for an IMG. And also, doing electives over here in India, do they count, do they count as, in your CV, like taking an LOR from the HOD or Dean or something like that?
Yes. So definitely, at least with coronavirus, I think doing electives in India, or working with maybe a pediatrician, or maybe working as a medical officer, I think that will count more so now than it did before. And I think that more of it is just to stay active after you graduate from internship and you're applying. I think that is definitely helpful. And getting an LOR from your HOD, it's good. Like I had one LOR from India, and the rest of mine were from here. But I did have one from our, head of department for pediatrics. And I think that really helps. And it's okay to have more than one LOR from India. It's okay. Again, they do want you to have some from here for sure, because it kind of shows how you're adjusted to the US system and how you manage to work with US people.
Exactly,
But
yeah.
having an LOR from India is not the end of the world. So if that's your last resort, use it. And then going into more clinical electives, I think having at least 1 or 2 is a good idea, even if it's just for 2 months. I think it's good to have that because you'll learn more about the US system and how it works. Also, I think one of the main things to do is you can always research programs and their websites to see what their minimum requirements is, because every different program has a different requirement. Some people want 6 months, some people want 3 months. Some people are like, if you don't have, any experience, that's okay as well. So I think starting out early, doing that to see how much you need to do and what field you're applying is important. Again,
Okay, so that also adds to the elective side, like doing a research program in any such universities for
yeah, so that
IMG.
doesn't add to your clinical electives because a research elective is different, but it does add to your CV in the research portion of your CV.
Yeah.
So you can add it on there. Doing a clinical elective in itself is a little bit different than research because you're actually getting to interact with patients and seeing how the doctors here interact with them. So getting at least 1 to 2, I think, is important. And again, a lot of people apply and say that, you only need a university base or like a university one. That's the best way. That is not true. I feel like, we put so much importance on getting a university one that we forget that there are private ones as well, and it's okay to have a private one. So again, if you're going to go in order, yeah, getting a university one is good, but if you're not able to get it, going through a private company is good as well. Yeah, it can cost some money. You'd have to be mentally
Exactly.
prepared for that. But, not having one versus having one, I think, is important. And then again, reaching out to family, friends, and just letting them know that if you know a doctor that would be willing to work, getting that would be important.
Okay, was good. Um, Now, as we all are aware that from February 2022, this USME, that's a very dynamic process. They keep on changing its rules and regulations. So I guess from Feb 22, it's going to be the historic step 1, numeric 3-digit score. It's going to be converted into either pass or fail. So what, according to you, will be the impact on IMG?
So again, this is a very new thing to a lot of people, but just kind of hearing what I've heard, I think having a step 1 pass or fail can be a good or bad thing. One thing is like a lot of students like IMGs try to make sure that their step 1 is stellar so that they have kind of an edge to people. So I think now with it being pass or fail, I think there's going to be more importance on your CK exam, your CK score. So I think working towards getting a higher score there will be important. Another thing will be your CV. Having a well-rounded CV will be important. So I think working towards that will also help. And then again, I think it'll go back to how your personal statement will look. So, working towards writing a good personal statement will be important. And then a lot will have to do with how you're viewed in your LORs as well. So I think with the step 1 becoming pass and fail, your step 2 CK score is going to matter a lot more.
Even the CV, right? There's going to be more importance on the CV.
Yeah, I think
and what about
the importance on that too.
And what about the hobbies? Like if you include in the CV, like is it worth adding those hobbies to the CV?
Yes. Okay. So hobbies, you know what? A lot of your interview questions will be based on your hobbies. Surprisingly enough, they'll ask you maybe a few questions about what you did clinical wise, maybe what kind of a cool patient case you might have seen, but then a lot of your questions are geared towards your hobbies. So if you don't like something, don't put it on your hobby list just because you think it'll make you look cool. Don't do that. If you have like a really crazy interest, please put that in there. I've had so many, my colleagues say like, oh, we talked about this or we talked about this. And one person was really interested in beekeeping. Okay. And they put that in their hobby list and their whole interview was based on that. So it's very important that, you list very specific things that you like or that you want to talk about in your interviews that will make you seem like a interesting person. Yeah. So don't put fake stuff, please. If you haven't done something, if you don't do something, don't put it in there. But if you do do something like very interesting, then go ahead and put it in there. I think that'll be really good.
Yes. So, looking back at your inspiring journey, Dr. Rutvi, any piece of advice you would like to give to the fellow USMLE aspirant? No, I mean the audience who have joined us tonight. I mean in this session.
Yes. So one thing that I definitely want to say is start early. Please start early. I know, there are many resources out there to, see what works for your type of how you study and what works for you. Entering medical school, obviously you're a very smart person if you're going into medical school. Just figuring out what works for you studying wise and then applying it in your USMLE journey will be important. There are many websites that you can use, like Reddit has reddit.com. They have like a medical school page. They have a USMLE page. They have a US IMG page now. And a lot of people talk about their experiences on there. So asking questions on there will be important. But again, just starting early will be definitely helpful. Having that repetition of questions, having that repetition of all the information that you might have done in first year, but you forgot in second year. I think doing flashcards is important. And then one thing is, it's going to be tough. There are going to be days where you're going to feel like you want to quit, where things are not going your way. Leaning back, have a good support system. Talk to your friends, talk to your colleagues, and just try to not one-up one. Like, don't discourage a person if they're trying to, study for this. I think having a really good support system, talking to your parents, talking to your friends, even people that are not in your medical community, talking to them will be important. And have a break time. Do not just study. You will burn out. Take break time, hang out with your friends, and just, with COVID, social distancing, but just have to yourself, take breaks, and you can do it. It's not impossible. People have done it. You can definitely do it.
And again, one more question I wanted to add in that electives, like, now because of the COVID, everything it's virtual. So what do you think about the tele rotations, like, tele rotations, and then compared to the rotations which one gets to do, like going all the way to US, like your views on such thing?
So I have not really seen a telehealth rotation, how it works and stuff. But I think that if it's the next best option, maybe exploring it wouldn't hurt. And maybe just talking to the people that are offering it, trying to get how it works, how you get to see how the system works is important. So just talk to the people that are offering it, ask questions like, what is this going to help me with? What is the structure like? Am I going to learn anything, or is it just going to be a waste of time, waste of money? And see how much you'll get to interact with the actual physician, so you'll get a better LOR. I think researching on that, I haven't been able to do that, but I think just talking to the people that are offering it will help you get a better idea as to what it is. But I mean, again, if it's your next best option and that's your only option right now, maybe exploring it wouldn't be such a bad idea.
Okay. So you mean at the end, it's the LOR that matters a lot rather than doing doing the either it's university or private electives. It's just the LOR which matters a lot.
I think trying to find a physician. Well, I mean, obviously it's going to be hard to judge before you work, but what you kind of want to get out of your elective is you want to learn how the US system works. You want to see how you're supposed to communicate with patients, how you're supposed to interact with them, what we do management-wise, like in basic diagnosis, your bread and butter cases. And then trying to get a more personalized LOR is kind of what you're trying to get out of an elective is, basically that. Just trying to get not a general LOR, where they're saying like, oh, this is a good student, maybe like where they would give specific examples of how you communicated with the patient well, or how you tried to find out more about a patient. I think that should be kind of your goal towards getting it. And it's, getting an LOR from a private physician is not a bad thing. Like it's a good thing, because maybe if you work with them more, they see how you work with, you might get even a better personalized one. And yeah, some people say that, you don't have the university head letter on it or something, but I think it's okay if you're able to get a more personalized LOR from a physician that yeah.
Yes. So I think I'm done answering all my questions. So I think we'll take up the questions from the audience. So one second.
Okay.
Yeah. So we have this question. What's the ideal year to give the step one according to you? I guess you answered that, but still, but should people attempt it while they are in their third or fourth year and while studying the syllabus which is still afresh? What's your view on giving USMLE while doing MBBS simultaneously?
Again, I think that is a very personalized thing, because it's how you study, how you retain information, and how you feel you'll be comfortable with doing your MBBS and your USMLE studying. Because the approach to USMLE is a lot more application based than it looks like. And then for India, a lot of it's memorization. So I think if you're able to memorize while also doing an application based, if you want to attempt giving your USMLE during your MBBS, that is completely up to you. And, go for it. If you can definitely think you can do it, I would say go for it. But again, sometimes people are not able to do that. So taking a gap year to do that, that's okay too. Just again, making sure that you are able to explain why you took the gap year that you did is important. And my view on giving USMLE while MBBS, it's again very personal based. If you want to do it, go for it. If you don't want to, if you're not comfortable doing that, waiting is okay as well. And a lot of people actually do ask me this question as well. Do you think it's okay to give step 2 before you give step 1? For me personally, I think it's easier to give step 1 first, because it creates a foundation for your step 2. And I think that it makes it easier to give step 2 when you gave step 1 first. And I felt like studying for step 2 was easier than studying for step 1. So maybe getting the hard one out of the way before, approaching the easier one would be something to keep in mind. Pathoma versus Robbins. Robbins, I use that during MBBS, right? So I think, again, Robbins is very detailed, and Pathoma kind of gives you an overview of everything. So Pathoma probably for a holistic idea of what's going to be asked on your exam, what's more important, would probably work when you're doing it towards the end, when you're doing it towards your dedicated. Once you've learned everything, I think Pathoma would be good for there. But if you want to use Robbins initially when you're starting out studying, so that you have all the information that you've read everything once, I think that way with Pathoma versus Robbins. Any other questions? So how to get clinical experience in your second year in India. So, I mean, I think with MBBS, we do have clinical rotations in our morning, like we go for our clinics in the morning. So I think like tours in the US. I think getting clinical experience during MBBS, again, you'd have to take a break for your rotations and you'd have to make up for them later on. I would try to aim to do your rotations probably end of final year before internship or during your internship, where you're still counted as a student for some university ones. Yeah, I think doing an experience during your MBBS might be tough, because then you have to make up those rotations, your attendance and everything later on. So maybe doing it towards like the end, of final year, or during internship would be better, because it's easier to make up internship days rather than making up for attendance for, like an actual MBBS year. For step 2, it's called Online Med Ed, ONLINEMEDED, Online Med Ed, and they have videos on there too. Entering medical school, starting early, heard a lot about it. What to do exactly? Second year, I think in second year, again, doing more flashcards and starting to use more resources. You can even start using UWorld during second year because you have more time. So you can, do the flashcards again, study your resources from first year so that you keep that fresh in your mind, and then doing questions would be helpful in second year. Publication. So again, this is a very, if you have access to it, you can do it. If you don't, that's okay. Publication, sometimes it matters. If you're applying, depends on what field you're applying into as well, or what kind, where you're applying. I think it matters. If you're gonna be applying towards a more top program, top university program, they'll probably look at research more. Whereas in like a community program, they might not look at it as much. Ideal number of publications, honestly, if you can get one, that's great. If you cannot, that's okay too, but just making your CV more geared towards the field that you're applying in is more important than, a publication, because I know some people are they don't have access to research, and that's okay. So I think it's not the number. I think it's, if you're able to get one, that is great. That definitely helps a lot. But if you're not able to, that's okay. And making your CV better in a different way would be important. So I think this depends on if you need a visa or not. I'm not 100% sure about this question. I would have to research it a lot. I would have to research more into this question. I think asking the people that you're applying with would be important. I think private companies don't require it. Maybe universities might, but I think asking whoever's giving this elective would be important to ask them first. Basic science. So yes, they are definitely interconnected. I think the best way to do this would be to, again, start out with your flashcards in your first year, so that you're remembering things, and then to cover first year and your second year, again, using those flashcards because it gives you continuous repetition of what you learned in your first year into your second year. And again, starting to do questions in your second year would probably be helpful, because when you're doing those questions, it asks you in a more application-based way. So that way you'll have to remember your first year stuff and you'll have to connect your second year stuff with it. And I think that would be the best way to do that. Excuse me. I think doing activities as a medical student, I'm not sure about unions and as such, because I didn't participate in that. But, if your college has, like we have our annual cultural events of the year, if you want to take leadership positions in that, I think that will show that, you want to be a leader. And that will make your CV better as well. It shows that you're able to organize things, you're able to be a leader, you're able to delegate things. I think that does help, and that does make a difference when you're talking about it in your interviews, because they might ask you a question like, when was a time where you had to be a leader and how did you deal with that situation? Or when was a time where you disagreed with someone in a leadership position? How did you handle that situation? So I think taking part in these activities is really important. Also, if you have sports events and culture events, take part in that, because it shows that you're a well-rounded student, that you do more things than just study, which sometimes is an important thing, because they do want to hear how you're able to relax, how you're able to, give time to yourself and stuff. So I think it does make a difference holding a position. Online, sorry, step 1. For step one, I used UWorld. There are many other step one question banks as well. I did not use them, so I can't give you an opinion about them, but I really liked UWorld, and I think it's one of the better ones. Choose a new CBME. I'm sorry, I'm not sure what the CBME is. If you're talking about like a different curriculum that they're using in step one, I'm not sure. Could you rephrase this question, if possible? Can you ask it again, please?
I think I think he's trying to say is that during after certain time, like as I told you before, USMLE is a pretty dynamic
Yeah.
process. So I guess there's something CBME is coming into picture in a few months. I think along with the Feb 2022. So how does that change the preparation for the exam? Like, does it remain the
Okay.
same?
So
Yeah, that's what.
I have not heard about this, so I cannot give you an idea about it. But if you want, you can email me and your email ID, and I can look into more on this and then let you know how to. I can help you out with that. Do IMGs get it? Yes, they do. They do. There's been a lot more people getting accepted into surgery. There's some people that get into neuro. There's people that get accepted into family med, radiology, ophthalmology. Yes, it is harder to get into these things. You probably do need a little bit of a higher score. You probably need to gear your CV a lot towards that. And some of these higher end ones like radio, ophthalmology, ENT, they do probably want research, but they do get in. It's not impossible. So maybe just trying to research more about that, talking to people that have been getting into these programs would be helpful as well. Okay, so visa work. Unfortunately, I do not have an idea about how visas work as much because I was a U.S. citizen and I didn't have to do this process. So I mean, I know people apply J1s, H1Bs, and the thing with I think H1Bs is that to be able to have that, I think you need to take the step 3 exam before you get into residency. So I think talking to people that have gone through this process would be much more helpful to you because I personally do not know about this process. Do local students have more benefits over IMGs? If I'm able to answer this question, do you think a US student applying in India would get more preference than an Indian student? I don't think so. Again, US students, obviously, they need to match. Their colleges need to have that percentage of the matching rate. So yes, they're going to get a little bit more preference over IMGs. But that being that said, a lot of programs take a lot of IMGs. IMGs do get accepted. I think our rates went up to like about 58 to 60% this year with the match season. So more and more IMGs are matching. So please don't let that discourage you. But again, it's going to be like, yes, the US students definitely have a better match rate than IMGs because they're local. They're going to take more students from their own country than they are going to be taking from IMGs. And I think that applies kind of in every country you would go to. Yeah.
Okay, so I guess the earlier question was not on the USMLE system, but
Yeah.
on the India because the MCI is resolved, and I guess they are doing a lot of changes in the Indian medical curriculum. So I think that guy was talking about this
Oh, so
question.
like your second year is now only 11 months, is what he's saying, right?
Yeah,
Okay,
and
so
yeah.
maybe that would, like people that have been taking their exam in the second year might not have enough time to take it. So then again, that would probably change your idea about when you want to take the exam, I think would approach. But I don't think that should hamper you from doing questions or flashcards or studying for USMLE. honestly, if you start early out with questions and stuff, I think that is definitely helpful. So maybe just keeping in mind that you have less time during your second year, so you're able to study for your MBBS exam, and then if you have time, you can do USMLE as well. So I think that would be the main change in your preparation. You know what? I think they would. I think they might accept it as an outside elective, and they might consider it a little bit. Again, I think the Canadian system works different from the US system because in Canada they have universal health care, whereas in the US we still don't have that. So I think it might help. I'm not 100% sure about it, but yeah, maybe it's closer. The Canada Canadian healthcare system might be closer to the US than India is. So yeah, it might help you a little bit, I think.
Okay, so this is the like in India, after like in your probably in your year and in my year, and after 2016 batch, we have to give this next exam in order to practice
Oh,
in India. So the NEET and next is a huge fiasco going on currently in India. So how this is going to affect the 2070 batch onwards?
so honestly, I would say that I'm not sure exactly when you have to take his exam. I wonder if it's like right at your last like month of internship or if it's like a few months after your internship. Depending on how that is scheduled, maybe you can take some time off during your internship to go and do an elective or two in the United States and push your internship back a little bit. I think trying to do that might help. But if not, then maybe after you give that exam, and after you kind of work in India, then maybe trying to go after that point.
So, will it be difficult for IMG, like for this? I mean, IMG especially for India, like this system, like
I'm not
next
sure.
and
I
NEET,
mean,
then we
maybe.
have two exams.
Yeah, so maybe the only thing it might do is postpone when you apply. So like there might be a gap between like your
Gap
graduation
year,
and when
yes.
you apply. But again, if you have to work in India, you have to do it. And it's something that you can talk about in your interviews or even in your personal statement, saying how, we had to do this experience, and maybe that'll, you can put a positive spin on that. Like you learned so much more from doing this experience and you feel like you're better qualified to make better decisions. So yeah, maybe it might postpone when you apply from your graduation date, but I don't think it would affect you too much as long as it's like I think between like less than 5 years. I think that that's okay. Pre-match. So I think matching is better than not matching, of course. Depends on how many interviews you have, depends on how you felt about the program that is offering you the pre-match. It's really a personal decision. It's a very personal choice, because sometimes people want to wait for the match. If you got like 10 interviews and 2 of them are pre-matches, you still have a chance with 8 places. Maybe if they feel like they interviewed well, they would, feel comfortable going into the match. But if they feel like they didn't, they might take the pre-match position. Again, it's a very, very personal choice. It's up to you how you felt about the program. Do you feel like you're a fit for the program? Do you feel like you'll be happy there? Do you feel like you'll get opportunities there? Very personal. And I think that, it's a case-to-case decision.
Is it as worth it as the normal match, like I mean a regular match cycle, or is it kind of more? This is more important, or what do you think on this?
I
Like
mean,
if I compare both.
if I compare, like, you're going to graduate from the program, you will get a job after you're done with the program. You still have a, ACME accredited residency. I don't think it makes a difference as to how people are going to view you later in life. it's a very personal choice, because sometimes people are more comfortable with taking a pre-match position so that they know their match. They don't have to worry about it later. They don't have to deal with the match cycle itself. It's a very personal choice. It's how you feel about, the program. It's very important. Like people, it's very important to feel comfortable at a program. It's very important to feel like you're going to fit in there, because you're going to be there for the next 3 years of your life. You're going to be working with those people for the next 3 years. It's very important to see who you're working with, how you felt, if you're going to gel with them, if you're not. It's a very personal choice. How much time would you suggest one should do an elective? I think at least having 1 to 2 is important, which will probably be around 1 to 2 months long. Sometimes if you're able to work with a family physician or like a family friend doctor, they might let you work with them for more than 6 months. It kind of depends, but at least having 1 to 2 months is important, because, or even sometimes 3 months, because some programs require you to have 3 months of experience. And again, researching that information is important, like which field you want to apply to, what programs, how much time. I think that's important to kind of go into that. Okay, so it has to be given before internship. Okay, so then, you could make some time during your internship to go to a place and work there, and to extend your internship. That would be okay. Observership versus an actual clerkship, I think, yes, getting a hands-on experience does help you a little bit better, but an observership is not a bad thing. That definitely still counts as an experience that does go into your CV. So I think doing it is good. 3 months in the same university or different is better. It's if you can do it at the same university and you get to work with more people and you get more LORs that way, go for it. If you feel like you're only going to get one LOR and you need more, you can go to a different one. It just kind of depends. Should Indian think an aim of matching to? You know what? If you want to go into surgery, go for it. I definitely do not want to discourage you. Yes, it's a little bit more tough. Yes, there's more competition. But if you want to do it, and if you can work towards doing that, go for it. If you can, I think the best way to probably do that is try to find an elective here that does, surgery, like a surgery elective here, maybe working towards more research for surgery, doing case reports, showing you're actively working towards a surgery match would be important. Like maybe, even working in India with some surgeons, like that might allow you to work with them. I think if you want to do it, you can do it. People have done it. Just work harder towards it. How important and useful is research? If it depends on what the research project is. If it's more towards your field, like internal medicine, you might be doing, more if it's an internal medicine type of a project, like maybe you're looking at diabetes, maybe you're looking at hypertension, how to improve it in your community, it helps. Again, it depends on what the research project is and if it's geared towards your field or if you're able to explain how it helps you in your field. I think it's important and useful.
Okay, so this question, like a lot of med students in India, they are such a confusion, like whether they should be working and getting distinction marks and doing their med school or just passing. So I think.
So if I give you my personal experience, my highest percentage was 64%. My lowest was 56. So passing, they're gonna look more towards your USMLE scores, maybe the pass and fail, and then your step 2 to kind of gauge where you're at with the medical students in the United States. I think your medical school scores don't really count as much. So passing would be enough. If you do get like a gold medal or you pass with distinction, of course, that's a added benefit and that helps, but it's not going to make or break you if you're just passing.
Okay, so when you, and this is one more question, like regarding this, like I wanted to ask, like when you write your during in your CV or in your ERS application, like in the format, do you have to mention something about your med school scores and how were you good at the subject?
No, so you don't have to mention that in your CV at all. Your med school will provide you with a transcript that will be sent to ECFMG. They'll certify it, and then they'll send that to the programs. So it's going to be in your transcript, and that if they look at it, they look at it. If they don't, and they just look at your score, that's what they look at, and they'll look at your CV. So it's going to be in your transcript. You don't have to talk about it in your CV at all.
Okay, thank you.
Would you prefer giving step one? Honestly, that's a good and a bad thing. If you did a really, if you scored really well, you're going to want your score. If you didn't do really well, a pass or fail system would work for you better. Honestly, I can't really give you an opinion about that. I think we're just going to have to see how it works out when we start using this system. Again, you're going to have to work when it does become pass or fail. I think there's going to be more importance on your step 2 and your CV. So maybe trying to work towards that, if you know that's the time you're going to be applying in, would be helpful. Is working for a 2-3 week observership in an Indian reputed? I think it helps if it shows that you're still active in your field. If you're able to get a really, really good LOR, maybe from this person, it would help, and you'll be able to use it in your application. I think it'll help. I think the main goal towards, doing an observership in India would be just to show that you're active in the field that you want to apply in, and you're continuing your process. You're continuing your doctorate work, or you're working in a clinical situation. So I think doing it doesn't hurt, and it just kind of shows that you'll stay active in your field. How would you describe writing your personal statement? What points would you? So personal statement, that is where you're going to be talking about yourself. I think one thing that you do need to address in your personal statement are any setbacks that you've had during your medical, any setbacks that you have or any weaknesses that you find in your application would be addressed better in your personal statement. But then one thing definitely to take care is not to, if you do talk about it, talk about how you improved yourself or how you bettered yourself, and explaining how you got out of that kind of a situation is important. Another thing to talk about in your personal statement is why you want to apply in the field that you're applying in. And I think making it in that sense will be helpful, just to talk about why you want to do what you're doing. And then talking about yourself, like any experiences that have shaped you, that have made you work towards this goal, particularly talking about that would be important. Any other questions? What are your views on doing Observer? Again,
yes, this is the last question, probably the last question.
Okay. So again, doing a hands-on is great. If you can get it, perfect. That does help a lot. But if you're not able to get a hands-on and you have to do an observership, it still counts as an experience. Yes, it may not count as a hands-on experience. And some programs do say, we want this amount of hands-on experience, and observerships don't count. But also a lot of places do count an observership as a clinical experience. So I think having an observership versus having nothing is better.
And if this is the question I had for observationship or electives, I have heard about AMO and other organizations which help students find good electives. Like, are they worth it, or you should go and apply directly on the website?
So the thing is, I had a really tough time, finding a university one. So I did use AMO, and I did get a hands-on experience from the physician, and I did get an LOR from this physician as well. I think it does, if you cannot find anything, and you have to use a private company, go for it. I think AMO did do a good job of letting me know what the experience was going to be and how it was going to go. So I think they were pretty transparent about everything. They do have some inpatient ones as well that I've known a few people that I've known people that have done it through them. And I think they do help out. So I think if you have the means to do it, go for it.
Okay, so I guess that's all. I don't have any more questions right now. I don't see. So first of all, thank you so much, audience, for joining in this session of the USMLE IMG Pathway series, and thank you, Dr. Rutvi, for taking your precious time out of the hectic residency and coming here and mentoring all of us USMLE aspirant. And to all the audience, thank you so much for joining tonight. And moreover, you can if you wanna stay updated, then you should follow a scholarship track on either on LinkedIn or you can subscribe to our channel, that is a scholarship track, and you can also hit the bell account, the bell button, and so you get notification whenever there is a live event up. So thank you so much.
No problem. And I just wanted to say my email. You guys can email me questions anytime, and I'll get back to you as soon as I can. It's rshah, SHAHIMG33@gmail.com. So you guys can go ahead and email me whenever you have questions, and I'll try to get back to you guys as soon as I can.
And about Rutvi's PDF, she has documented her entire journey pretty well in a PDF. So any of you want, you can either reach out to Rutvi or you can text me and I'll help you out with that. Right, Dr. Rutvi?
Yes, that would be perfect. Yep.
Yeah, thank you so much.
No problem. Thank you.